Case counts from the coronavirus infection are rising, and now our hospitalizations are rising, which means we need to be cautious until our vaccination rates are higher. Here are the numbers. Since this time yesterday, we've identified 533 new cases of the coronavirus infection in Philadelphia residents confirmed by the PCR test, bringing us to a total confirmed case count from the beginning of the epidemic of 120,490. And in addition, 160 probable cases diagnosed by the rapid antigen test. Now, for the past week that ended on March 20th, we averaged 400 cases per day. That's counting the PCR and antigen tests combined. So far, we expect that there be more. And of those people tested, 6.1% of the people tested positive. To put that in context, the week before, we averaged 287 cases per day, and 5.4% of the tests were positive. So it increased both in the number of cases per day and the percent positivity. Case counts are not only rising here in Philadelphia, but they're also rising in Southeast Pennsylvania as a whole, and in Delaware, New Jersey, New York, and in the New England states. That's what's happening in the cases. Also, we are seeing this in the city's hospitals. We had hit a low point on March the 7th, where there were 203 people hospitalized with the coronavirus infection in all the Philadelphia hospitals combined. With the increasing case rates, that number has been rising, and today the number was 318. Now, the hospitals are not under strain yet. They can deal with many more people who are hospitalized. But the fact that this hospitalized number is increasing at all is a sign that the infections that are occurring are hitting vulnerable people, not just young, healthy people. As far as deaths, we've got 8 new identified deaths, bringing us to a total of 3,230 since the beginning of the epidemic. We were averaging about 25 to 30 deaths from the coronavirus infection in late February. That's been less than 20 per week now in March so far, but we expect more because there's often delayed reporting on deaths. We do expect, because of the lag in when people die from this infection and then the lag in when we hear about those, we'll see a rise in the number of deaths in March and in April. I'm going to turn now to vaccination. The supply of doses we're getting from the federal government has been stable over the past couple of weeks. Allocated last week for delivery this week are 22,200 first doses of the Pfizer vaccine, 15,600 first doses of the Moderna vaccine. Those numbers are unchanged from the week before. And then in addition, there were about 8,000 first doses of the vaccines to pharmacy chains delivered directly from the federal government, which brings us to about 45,000 total first doses that are coming into the city. And then later, the second doses follow up to match the first doses that have arrived. Now, the federal government is saying that there'll be no increase in the number of first doses that are arriving here in the next couple of weeks. In addition to that, though, we do have the vaccine that is coming to the Center City Vaccination Center. We're getting 42,000 second doses per week that are going to be starting this week as they move into the second dose phase. Let me talk about administration of vaccine across the city. As of Monday evening, we reported vaccination on a total of 447,000 people for their first doses and 175,000 people for their second doses. Of the people who are Philadelphia residents, 19% are known to be partially vaccinated. And that 19% is an underestimate because it doesn't count Philadelphia residents who may have been vaccinated outside the city. Okay, we've already discounted the people vaccinated in the city who don't live in Philadelphia, but the Philadelphia residents who might have been vaccinated elsewhere, we don't have that number. So the 19% is a low estimate. Of the people over the age of 75, 44% are known to be vaccinated. And of those aged 65 to 74, 33% are known to be vaccinated with at least one dose. And again, those are underestimates. Now, those percentages are not enough to change the direction of the epidemic at this point, but they are enough to prevent some of those deaths from occurring from COVID because we are getting into a meaningful percentage of the people who are in the vulnerable age range, 65 plus. Now, for the week that ended March 14th, all the healthcare providers in the city of Philadelphia combined delivered 104,000 doses of vaccine to people. Now, for the last week, the week that ended last Sunday, that number is likely to likewise be above 100,000 when all of our data is received. We don't have a total number on that yet. Those are both up from a 54,000 doses just 2 weeks before. So we are seeing big increases in vaccinations. It reflects in part the Center City Vaccination Center, but also reflects increases in vaccine delivery by other providers across the city. But how is vaccine being made available today? We now have 204 sites that are enrolled and are receiving vaccine. That includes hospitals and clinics and pharmacies and some community providers. Last week, in addition to the providers that are not run by the city of Philadelphia, there were 3 new clinics that were added by the Department of Public Health, my department, in Nicetown and in South Philly. And this week, there are additional clinics that are being run by the fire department. In the Northeast, we're going to be at Cancer Center, Volksfestverein, at 9130 Academy Road tomorrow. The team will be at the Salvation Army at 5501 Market Street on Friday, the 26th. And they'll be in the Northwest at 7800 Ogons Avenue on the 28th and on the 29th. In addition to that, the teams from the health department will be doing our second dose clinics in North Philadelphia and West Philadelphia this weekend, repeated in the coming weeks. Now, at some of these sites, the advance appointments has been low, and so there have been appointments available. At some of these clinics, we have, all the clinics, we're inviting people from our database to go there, but if there's still open appointments, to the extent that they're available, we're allowing people to walk in. Now, let me talk about the convention center clinic specifically. Yesterday, that operation finished up its first dose. In the last couple of days, they were doing more than 7,000 doses per day. The total number of people vaccinated, including the soft launch day on March 2nd, through yesterday was nearly 122,000. So a very large number of people vaccinated in a short time at that site. As you know, in the last 6 days of that operation, we enabled walk-up access to the targeted zip codes. That would be the 22 zip codes that had the lowest vaccination rates in the city. And that was in part to increase the diversity of those people who were vaccinated, and it worked. In those 6 days, of those people vaccinated, 18% were African American, 15% were Hispanic, 20% were Asian, and 37% were white. Now, this is something important. For the next 3 weeks, that operation will be doing only the second doses for people who have already received their first doses at the convention center. And I can use some help from the press on this. We continue to have a problem with the scheduling software that has a security hole that people can get it into. The software was designed to help people schedule. It was not designed to keep people out. And so because of that, uninvited people got links for the time period when we're only doing second doses, and they shared those links widely. So we have many unauthorized appointments that people got over the internet or from a friend or on a Facebook post or another social media post. Now, we have canceled and are canceling all unauthorized appointments. And we're sending emails to people saying that their appointments are canceled so that they should not come. But we need to get help from the press to get the word out for those who may not be receiving their emails. The convention center for the next 3 weeks cannot take people for new first dose appointments. Because if we did that, then we would not be able to give them their second dose 3 weeks later. So for anyone, if you have not already gotten your first dose at the convention center, don't come to the convention center now requesting vaccination. In addition to that, we will have staff on site. And so if there are people who do come who haven't been reading their emails, expecting vaccination, who are new, if they're eligible Philadelphia residents, we will schedule them at one of our neighborhood clinic sites. And for those who are not eligible because they're not in phase 1A or 1B, we'll enter them into the vaccine interest database. Now, after these 3 weeks, when we're giving the second dose for people who received the first dose already, there'll be at least 2 weeks left of federal support. We got confirmation yesterday that we will be getting the Johnson & Johnson vaccine for those 2 weeks. That's a vaccine can be given in a single dose. And that's very advantageous to us because then we don't need to worry about how we get a subsequent second dose into those people. So at about 6,000 people per day, that means that over those 2 weeks, there'll be about 84,000 additional people who will be fully vaccinated at that site by the end of April, which will bring us to more than 200,000 people fully vaccinated at that site when it's finished. So what should people do who want to get vaccinated? The same step we said before. Go to www.phila.gov/vaccineinterest and put in your information. If you don't have internet access, call 311 and we'll sign up for you. And that's the way to get directed to many different vaccination opportunities, not just the convention center, but other sites as well. Now, let me turn to our safer at home restrictions. Last week, Governor Wolf announced that there was easing of restrictions in the Commonwealth of Pennsylvania, effective Sunday, April 4th. He's going to allow restaurants to go have an indoor dining capacity up to 75%, and indoor events up to 25% occupancy, and outdoor events up to 50% occupancy. Now, we are very concerned about the rising COVID rates and now the rising hospitalizations. And still, there are more than 20 deaths occurring per week. And we believe that those changes, if we adopted them here in the city of Philadelphia, could further increase rates of cases and hospitalizations and deaths. Now, we do think the vaccination can dampen the epidemic, but vaccination coverage is not high enough yet to have a substantial impact on that. Now, we do think vaccination will be accelerating in April. Our projections are that by April 30th, we may have vaccinated 50% of Philadelphia's adults and 75% of those who are 65 plus, at least having given the first dose to those people. So we will not make the changes that the governor's made in the city of Philadelphia on April 4th. We think it's better to wait for vaccination to protect people. But now there are restaurants and caterers who have asked for some sort of date so that they can plan. And so we are announcing today that we will increase restaurant capacity and allow indoor catered events and indoor gathering and increase our indoor gathering limit on April 30th if our case rates are declining as we approach that date. If they're still rising very quickly, we're not going to be able to make that increase, remove that restrictions. So it's April 30th if case rates are declining as we approach that date. Now, we will be making smaller changes here in Philadelphia on April 4th because of requests we've had. We will allow food that are served at business meetings to help the hotels. The hotels right now cannot do indoor catered events. They made a case that there are certain business meetings that are at fairly low risk and that they can follow safety standards. We'll be providing guidance soon for allowing food to be served at indoor business meetings. Right now, they can have those meetings, but without food. And in addition, we will be allowing, as of April 4th, outdoor catered events to expand up to 250 people with restrictions. This to encourage people who want to have their social events anyway to do them outside now when the weather is better. With those both, though, we strongly encourage anybody over the age of 65 attending any of these gatherings to be vaccinated first. There's still risk at these gatherings. And as before, if our case rates, if our hospitalizations, if our deaths rise, we may have to reimpose restrictions. I know no one is enthusiastic about that at this point, but we are very concerned about the direction where things are going right now, and we haven't vaccinated enough people to see an impact on our mortality. So finally, just a reminder that there's a lot of reasons still to be optimistic over the next few months, but not over the next few days or couple of weeks. Today, the epidemic is still growing, still here, and it's still deadly. Don't let your guard down too early. Wear a mask, keep your distance, avoid being around others, and as soon as it's your turn, get vaccinated. All of our information is at our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. Now, Armando will provide a summary of today's remarks in Spanish. Armando, you can take it away.
Estas son las palabras del alcalde Kenny. Buenas tardes a todos. La semana pasada, nuestro director de finanzas y director de recuperación habló sobre el nuevo paquete de estímulo federal y mencionamos un aspecto importante de esta iniciativa. El plan de rescate estadounidense tiene el potencial de ayudar a sacar de la pobreza a muchos estadounidenses, incluyendo los habitantes de Filadelfia. La semana anterior solo lo mencionamos de paso, pero es algo crucial, por lo que hoy quiero hablar más al respecto, porque necesitamos la ayuda de todos con esto. Los cheques de estímulo están brindando alivio a gran parte de la población de Filadelfia. Más de 1 millón de habitantes de Filadelfia se van a beneficiar. Y hay expansión notable de otros beneficios de alivio cruciales, como el del crédito tributario por hijos, por ejemplo. Por ejemplo, una madre con 2 hijos pequeños puede recibir $7,800 este año si combina el estímulo y el crédito tributario por hijos que ha sido ampliado. Estos cambios en el beneficio por hijos son potencialmente transformadores, especialmente si el Congreso logra que este cambio sea permanente, como han decidido hacer. Casi todos los niños de Filadelfia se beneficiarán con al menos $3,000 anuales por cada niño, lo que constituye una base confiable que garantiza que casi todas las familias de Filadelfia tengan ingresos para cubrir sus necesidades básicas. Las familias no tendrán que esperar hasta el próximo año para que el crédito fiscal entre en vigencia. Los pagos regulares deben comenzar el mes de julio. Y hay otros 2 aspectos importantes del paquete para los residentes que experimentan dificultades. La ciudad planea reabrir nuestro programa de asistencia de alquiler a los individuos para asegurar que miles de habitantes de Filadelfia tengan cubiertos sus mayores gastos domésticos y puedan tener una vivienda estable. Nuestro programa de asistencia de alquiler para los inquilinos ayuda a que los inquilinos puedan cubrir sus gastos domésticos y para fines de este mes se habrá abierto el registro para propietarios en phlrentassist.org. El American Rescue Plan también realiza cambios en el crédito tributario por ingreso del trabajo para que las personas sin hijos sean elegibles para recibir más dinero que nunca. La combinación de estos beneficios tiene el potencial de cambiar las reglas del juego para las familias de Filadelfia. En conjunto, los expertos dicen que los beneficios de esta nueva ley reducirán la pobreza a nivel nacional en más de la mitad en el caso de los niños, así como para las personas en hogares donde ha habido pérdida de empleo. Y reducirá bien las disparidades en las tasas de pobreza de las personas negras e hispanas en relación con las personas blancas no hispanas. Esas medidas serán aún más importantes en Filadelfia, donde la tasa de pobreza es más alta y donde más personas serán elegibles para poder beneficiarse de la asistencia. Si el Congreso hizo, este potencialmente será el mayor cambio en la lucha contra la pobreza en una generación. Permítame repetirlo. El subsidio por hijos es potencialmente el mayor cambio en la lucha contra la pobreza en una generación. Quiero agradecerle al presidente Biden, a la vicepresidenta Harris y a la presidenta Pelosi, al líder de la mayoría, Chuck Schumer, y a la delegación del Congreso de Filadelfia por su increíble liderazgo. Pero para que se sienta la plena promesa de estos beneficios, los habitantes de Filadelfia deberán tomar medidas, declarar sus impuestos, incluso si no suelen hacerlo o si no trabajaron este año. Es posible que el gobierno federal proporcione más instrucciones sobre cómo reclamar estos beneficios sin haber completado una declaración de impuesto. Sin embargo, mientras tanto, la forma principal de garantizar que usted recibirá los beneficios es declarando sus impuestos del año 2020. Presentar una declaración de impuestos significa que el gobierno federal tendrá la información que necesita para poder otorgarle tanto el estímulo fiscal así como los pagos de beneficios por hijos. Y queremos asegurarnos que la gente de Filadelfia sepa que la declaración de impuestos no debiera costarle dinero. Hay organizaciones de confianza en la comunidad que pueden ayudarle de forma gratuita. Vaya al sitio web de Campaign for Working Families para programar una cita en persona o virtualmente. Ellos se encuentran en cwfphilly.org. Les repito nuevamente, esto es cwfphilly.org. Y hoy se nos une nuestra directora de políticas, Julia Hinckley, para responder cualquier pregunta que puedan tener con respecto al impacto potencial del paquete de estímulo contra la pobreza en Filadelfia. Necesitamos la ayuda de todos los que nos escuchan y de nuestros amigos en los medios de comunicación para hacer correr la voz. Presente sus impuestos, incluso si no debe nada o no suele presentarlos, para que así pueda estar entre aquellos que reciban estos importantes beneficios. Y estas son las palabras del comisionado de salud, Dr. Thomas Farley, para el 23 de marzo del año 2021. El recuento de casos está aumentando y ahora también están aumentando las hospitalizaciones. Debemos tener mucho cuidado hasta que las tasas de vacunación también aumenten. Y comenzamos con los números del día de hoy. Tenemos 533 nuevos casos confirmados por la prueba PCR, con un total confirmado de 120.490 casos y de 160 casos probables detectados por la prueba rápida de antígenos. La semana pasada, del 14 al 20 de marzo, el promedio hasta ese momento es de 400 casos por día, detectados con las pruebas PCR y antígenos con un 6,1% de pruebas positivas. Para la semana anterior, del 7 al 13 de marzo, el promedio hasta el momento es de 287 casos por día, con un 5,4% de pruebas positivas. El conteo de casos está aumentando en el sureste de Pensilvania, en Delaware, New Jersey, Nueva York y Nueva Inglaterra. Con respecto a los pacientes hospitalizados, para el 7 de marzo, 203 personas estuvieron hospitalizadas en Filadelfia. Con las tasas crecientes de los casos, se prevé que este número también aumente. Para el día de hoy, 23 de marzo, hay 318 pacientes con COVID-19 que están internados en los hospitales de Filadelfia. Los hospitales aún no están a capacidad máxima, pero esto es una señal de que el aumento en las infecciones está afectando a las personas más vulnerables. En cuanto a los fallecimientos, para el día de hoy se identificaron 8 muertes por COVID-19 con un total de 3.230 fallecidos. En las últimas semanas, este número ha ido disminuyendo gradualmente de 25 a 30 muertes por semana a fines de febrero a menos de 20 muertes por semana en marzo hasta ahora, pero esperamos más aún, porque hay un retraso en el registro de las muertes en las bases de datos. En cuanto a la vacunación, el suministro de dosis va creciendo. Tenemos asignada esta semana la cantidad de dosis que se mantiene igual de la semana anterior, que son 22.200 primeras dosis de Pfizer. También tenemos 15.600 primeras dosis de Moderna, que también se mantiene igual a las de la semana anterior. Y hay 8.000 primeras dosis en las cadenas de farmacias distribuidas por parte del gobierno federal. Todo esto suma aproximadamente 45.000 primeras dosis totales y nosotros recibiremos la misma cantidad de segundas dosis para igualarlas. El gobierno federal nos indica que no habrá un aumento de las dosis asignadas para Filadelfia en las próximas 2 semanas y el centro de vacunación del centro de la ciudad recibirá 42.000 segundas dosis por semana. Con respecto a la administración de las vacunas, para el lunes por la tarde se informó que 447.000 personas han recibido su primera dosis y 175.000 personas la segunda dosis. Aproximadamente el 19% del total de los residentes de Filadelfia ya están parcialmente vacunados. Y estamos esperando incrementar ese número. Y estamos siendo conservadores con este cálculo. Hay un 44% de las personas mayores de 65 años y un 33% de las personas entre 65 a 74 años que han recibido ya al menos una dosis. No es lo suficiente para cambiar la dirección de la pandemia, pero es lo suficiente para prevenir algunas muertes por COVID-19. La semana que terminó el 14 de marzo se administraron aproximadamente 104.000 dosis. Es probable que para la última semana también estemos alrededor de las 100.000 dosis. Compartiremos el número definitivo cuando recibamos todos los datos. Esto, sin embargo, representa un aumento considerable por encima de las 54.000 dosis semanales que estábamos reportando hace 2 semanas. El aumento en las dosis representa el esfuerzo que se ha realizado en el centro de convenciones, así como en las otras clínicas de vacunación. ¿Cómo está disponible la vacuna en la actualidad? Ahora tenemos 204 sitios inscritos que están recibiendo vacunas. Estos sitios funcionarán como clínicas de vacunación. Estos sitios son hospitales, clínicas y farmacias. La semana pasada iniciamos 3 clínicas de vacunación en Nicetown y en el sur de Filadelfia. Esta semana iniciaremos nuevas clínicas en las siguientes áreas. Para el noreste de la ciudad, en el Kansas-Wolfex Bearing, en el 9130 del Academy Road. El 26 de marzo, en el oeste de Filadelfia, en las oficinas del Ejército de Salvación, o Salvation Army, en el 5501 de la calle Market. El 28 y 29 de marzo, en el noroeste, en el PDF, en el 7800 de la calle August. Y continuaremos con las clínicas de la segunda dosis en el norte y en el oeste de Filadelfia. En algunos sitios, el modelo bajo citas anticipadas no ha tenido mucha demanda porque pocos usuarios lo utilizan. En estas clínicas continuaremos invitando a personas que están en nuestra base de datos. Y a medida que haya cupo disponible, podemos permitir que más personas sin cita sean vacunadas allí. Con respecto al centro de vacunación en Center City, en el centro de convenciones, ayer terminaron 3 semanas de vacunación exclusiva con primeras dosis, 7.000 primeras dosis por día en los últimos 2 días. Esto totaliza casi 122.000 primeras dosis. El acceso sin cita previa a los códigos postales específicos ayudó a incrementar la diversidad de los vacunados. El 17 de marzo se vacunaron un 18% de africanos, un 15% de hispanos, un 20% de asiáticos y un 37% de blancos. Es importante considerar que a partir de las próximas 3 semanas solo se vacunará con segundas dosis en el centro de convenciones. Se vacunarán a las personas que ya recibieron su primera dosis en este sitio. Necesitamos la ayuda de la prensa para multiplicar ese mensaje. Continuamos teniendo problemas con el software de programación de citas. Este software fue diseñado para facilitar la programación de citas, no para excluir a las personas. Y algunos residentes la han estado utilizando con los mismos resultados y comiendo los enlaces ampliamente. Hemos detectado que muchas citas de personas que no viven en Filadelfia o que no pertenecen a la fase 1A o 1B. Hemos cancelado todas las citas no autorizadas, enviando la cancelación a los correos electrónicos que habían registrado. Pero necesitamos más ayuda para hacer correr la voz, hacerles llegar a aquellos que no leen sus correos electrónicos o no atienden sus teléfonos. El centro de convenciones durante las próximas 3 semanas no puede aceptar nuevas personas, ya que solo se administrará segunda dosis dentro de las próximas 3 semanas. Si aún no ha recibido la primera dosis, entonces no asista al centro de convenciones. Tendremos el personal en el lugar para programar a los residentes elegibles de Filadelfia en cualquiera otra de nuestras clínicas en su vecindario. Les recordamos que debe hacer su registro en Vaccine Interest o a través del número 311 y puede hacerlo en español. Después de estas 3 semanas de las segundas dosis, quedan aún 2 semanas con el apoyo federal. y se confirmó ayer que se vacunará con la vacuna de Johnson & Johnson, la cual requiere una sola dosis. A razón de 6.000 personas por día, de manera que tengamos a 84.000 personas completamente vacunadas para fines de abril. Esto representa aproximadamente 200.000 personas completamente vacunadas en el centro de convenciones para cuando terminen las operaciones en este sitio. Las personas que quieran vacunarse deben registrar su interés en fila.gov/vaccine interest o llamando al 311. De esta manera, usted podrá ser dirigido a múltiples oportunidades de vacunación. Con respecto a las restricciones del programa Más Seguro en Casa, la semana pasada el gobernador Walsh anunció la flexibilización de las restricciones a partir del día domingo 4 de abril. Los restaurantes ahora podrán funcionar al 75% de su capacidad. Los eventos en interiores hasta un 25% de ocupancia. Los eventos al aire libre mantendrán la misma ocupación de hasta el 50%, manteniendo la distancia de 6 pies. A nosotros nos preocupa el aumento de las tasas del COVID-19 y el aumento de las hospitalizaciones y los fallecimientos, con más de 20 muertes por semana. Nosotros en Filadelfia creemos que estos cambios podrían aumentar aún más los casos, las hospitalizaciones y las muertes. La vacunación puede ayudar a amortiguar este impacto, pero la cobertura de vacunación aún no es suficientemente alta. La vacunación se acelerará en el mes de abril y compartimos algunas proyecciones. Para el 30 de abril, el 50% de los adultos de Filadelfia podrían estar ya vacunados y el 75% de aquellos mayores de 65 años. Por lo tanto, nosotros no incorporaremos estos cambios en Filadelfia el 4 de abril. Es mejor esperar a que la vacunación esté lista para proteger a todos los residentes, pero adelantamos esta información para que los restaurantes y las empresas de catering que nos han contactado puedan planificar con antelación. Se aumentará la capacidad en el comedor interior de los restaurantes y permitiremos eventos con servicios de catering en interiores. También aumentaremos el límite de las reuniones el 30 de abril, si y solo si las tasas de cambio disminuyen a medida que nos acerquemos a esa fecha. Queremos cambios más pequeños el 4 de abril, tales como porque vamos a permitir que se sirva comida en reuniones de negocios para ayudar a los hoteles. Y publicaremos esta orientación con detalles muy pronto. También permitiremos que los eventos con servicio de catering al aire libre se expandan hasta 250 personas, con ciertas restricciones. Animamos a quienes realizarán eventos sociales a realizar el libre, ahora que tenemos mejor tiempo. Alentamos encarecidamente a los españoles que asistan a estas reuniones a que primero se vacunen. Y aquí un recordatorio. Tenemos muchas razones para ser optimistas durante los próximos meses, pero hoy la epidemia continúa entre nosotros, sigue creciendo continuamente y sigue siendo mortal. Por lo tanto, no podemos bajar la guardia demasiado rápido. Debemos continuar usando una mascarilla, mantener la distancia social y evitar estar cerca de otras personas sin tomar las previsiones debidas. Como sea su turno, por favor, acuérdense, solamente.
Lauren?
Yep. Thank you, Armando. We had just had a little bit of a delay. I wanted to make sure Armando was done with his remarks. We're now going to move on to Q&A for members of the press. In addition to Mayor Kenny and Dr. Farley, we are joined by Managing Director Tumar Alexander and Director of Policy Julia Hinckley, who can help answer questions related to the American Rescue Plan and the impact that will have on reducing poverty in Philadelphia. Because of limited time, only one representative from each media outlet is permitted to ask questions. Reporters should limit their questions to 3 or fewer. And as always, we will limit the first round of questions to the topic of COVID-19. If you have questions regarding another topic, please hold those for a potential second round. So if your hand is raised now and your question is not about COVID, please be sure to lower it and we will let you know when we're ready to open this up to broader topics. We are get started today with Mitch Blocker from NBC 10. Mitch, you should be able to unmute.
Thank you. Good afternoon, Dr. Farley. I have a couple of questions for you. So you said that cases are up across the region. And so with that in mind, I guess I wonder why not align with the rest of the state on reopenings? Why is Philadelphia special that it has to stay closed?
Well, I'm concerned that the rest of the state is opening up too much, and I don't think it would be the way only way that we can align is for us to open up more bars and restaurants, and I think that'd be risky. I don't have control over the decisions in the rest of the state.
But can you create a bubble within Philadelphia? I mean, if the rest of the state is making that decision, doesn't that influence your decision?
It is something we need to take into account. I don't think it makes sense for us to loosen up here. I do think we can prevent some risk by not allowing those restrictions to be relaxed in Philadelphia. We cannot prevent all risk. Some people could travel to the suburbs to go to a bar. We hope that they don't. And I think it's in the best interest of the city, the residents of Philadelphia, for us still to be restrictive, even though we can't control all of that risk.
We have followed the science from the very beginning, and I think that's what's put us in a position to do as well as we've done. The big concern for us is when hospital admissions start going up, that's a problem. And I don't know what the reasoning or all the rationale behind other jurisdictions making the decisions that they make. But this is Philadelphia. We're our own county, and we have the ability and the responsibility to keep our people safe. I mean, and that's what we think we're doing.
Thank you, gentlemen. Dr. Farley, I have kind of a medical question. Is it accurate to say that those who need to be hospitalized now are likely to have better outcomes than, say, 6 months ago? And I'm curious what factors might influence those outcomes that are different than towards the beginning of this.
We have seen a general pattern that the mortality rate amongst those hospitalized has been going down during the course of the epidemic. It's not entirely clear why. One thing is that the doctors and nurses there are getting better at treating this infection and learning what works. There are some more treatments that are available. It may be that people getting infected in more recent months got a lower dose of virus when they got infected, and so that it's less of an overwhelming infection when they got it. Unclear, but in general, the mortality rate amongst the people hospitalized is lower than it was. It's still substantial, though. It's about 20% of the people who are hospitalized end up dying from this infection. So when we see hospitalizations go up, that's reason for us to be worried.
Those 120,000 infections that you know about that you said total throughout this pandemic, do you have any idea how much of an underestimate that may be, and if there's possibly more immunity in the community than we're aware of?
We know that many people who got infected and never came to our attention, never got tested. The best estimates are that maybe 35% of the people in the country have had this infection. But that doesn't necessarily mean they're all immune, because it's unclear if you get the infection, how long you may be immune or how effectively you may be immune. We know that with other coronaviruses, you can get a second infection, and we know that people can get a second infection with this coronavirus. So there's probably some protection from that, but not everybody is protected.
Tanto las palabras del alcalde como el Dr. Farley se interrumpieron por...
Thank you, gentlemen.
Thank you, Mitch. And were you able to get that last piece of your answer? I had a weird interjection on my side. I just want to make sure you got the last piece of the answer from Dr. Farley.
No, I didn't hear the last 10 or 15 seconds.
Dr. Farley, would you mind doing that again?
I forget exactly what I was saying the last 10 or 15 seconds, other than that we do know that many people who had this infection never came to attention. They were never tested. Some of them are probably immune at this point, but some of them are not, and we don't know how many.
Thank you, Dr. Farley, and sorry about that issue, Mitch. Next up, we have Johan Calhoun from Chalkbeat. Johan, you should be able to unmute.
Thank you. My questions are for Dr. Farley and Mayor Kenney. Not sure if you saw my story on Friday. I'm dropping a link in the chat right now. But after the COVID outbreak at Mayfair Elementary School, a group of teachers and parents created a dashboard listing COVID cases. They're calling for the school district to create a dashboard. And I noticed that four of the top 5 largest school districts across the country, with the exception of Los Angeles, have trackers, and Philadelphia is listed at number 18 or 19. Why does the district not have a tracker? And have there been any talks of partnering with the school district to create a dashboard?
Let me just say that information. We do get some information from school nurses about cases that they know about in students. And we are, that may not be all the cases that have occurred. That may not, the school nurses may not be aware of cases that are occurring in students or teachers. But we're looking at whether the information we have available to us is something that we can make publicly available. And we're in discussions with the district about, if so, where would that information live?
Okay, the CDC is now recommending 3 feet of distance in elementary schools, regardless of an area's level of community spread. Do you recommend Philly to follow the CDC or remain at 6 feet for schools?
So we recommend that Philadelphia follow the Centers for Disease Control recommendations.
Okay, and last quick question: how are we looking with teacher vaccinations?
We know that CHOP has gotten the first dose into at least 19,000 teachers and support staff and childcare workers. We know that some of those people were not vaccinated by CHOP, and so some of them have been vaccinated at the convention center and other sites. So probably well over 20,000 people, educators who have gotten at least the first dose of vaccine. I don't know. I don't have a total number precisely, and I can't say what percentage of the total teachers that is, but an awful lot of them have been vaccinated or have gotten through the first stage of vaccination.
Okay, thank you.
Thank you, Johan. Next up, I have Sean Walsh from the Inquirer. Sean, you can unmute.
Thanks very much. The state of Pennsylvania has unpaid caregivers in Group 1A. The city doesn't have them in 1A or 1B. Disabilities advocates are say they have been lobbying for the city to include this in a priority group for months. Why has this group not been included in 1A or 1B?
Well, first of all, we did include people with disabilities in 1B, and many of the groups that the state is putting in 1A, we're considering 1B. Probably unpaid caregivers is, I'm not quite sure how to define that group. It needs to be more clearly defined. Could everybody just say that they're a caregiver of someone else? I don't want it to be that basically makes everyone eligible. And also unclear how large that group is. I'd also point out that we're not too far off from phase 1C. And so whether they're in phase 1B or phase 1C, they're going to be eligible fairly soon.
Thanks. And for folks who are having their appointments canceled at the convention center that may have scheduled it during the second dose period and they thought they were getting a first dose, while I've heard you guys talk before about how people who weren't invited should not take those appointments, I think just anecdotally, it sounds like there are plenty of people who didn't know that, including people who really need the vaccine and may have stopped searching for appointments after they got that appointment. What's being done for them, and is there anything to be said for the fact that they've sort of lost time on the hunt for a vaccine?
Well, if people got it emailed to them from a friend or if they got it from a website, they should have been suspicious that it maybe wasn't a legitimate way to get that appointment, in the same way that if you get a phone call that says that you won the lottery, you might be suspicious about that. And we have emailed them and to say, these are not appropriate appointments, they're canceled. A lot of people want to be vaccinated. We're making more vaccination opportunities available. To the extent that people come on site, we will have staff on site that will help them. If they're Philadelphia residents and they're eligible, we'll schedule them at another clinic. And if they're Philadelphia residents and not eligible, we'll get them into our vaccine interest database. So we are trying to help them out.
Thanks. That's all I have.
Thank you, Sean. Next up, I have Max Marin from Billy Penn. Max, you can go ahead and unmute. Max, if you're trying to unmute, you're not unmuted on our end. If you want to try that again.
Okay, is that
There
working
you go.
now?
Yep, you're
Great.
good.
Thanks, everybody. For Dr. Farley, are you familiar with a website called Vaccinate PA that shows lists of vaccine distributors across the state by county and provides real-time updates on where vaccine doses are available? And if you have heard of this, do you think that this is a good idea? Is this something that the city is monitoring?
There was a website that was set up a while ago. It might be that one. And I was concerned when I first saw it that the data did not appear to be very accurate. We are working on making available different sites and where vaccine is available in the city right now, something that would be more accurate. I should point out, though, that almost all the sites, the vaccination is by invitation. And so if we put up a website, it doesn't necessarily mean it's a place where people can just go in and show up and be vaccinated. And so we want to have the appropriate cautions around that. I think I'm concerned that what the state may be putting up may not be have a complete picture of what's going on in the city.
All right, thanks for that. Another question. Are you tracking Philadelphia's vaccination rate compared to other peer cities in the U.S.? Last week, you made a remark about how it's not a race, but I'm just curious whether you've looked at how other cities have fared and where you think Philadelphia stands in that.
Yeah, we've
process.
tried to look at it. There is no one metric for how quickly vaccines are being delivered by different cities. And it's surprisingly complicated when you look at it. Each city's measuring it somewhat differently. Do they count non-residents? Are they counting the first and second dose? How do they handle the different products? To the extent that I can interpret what I've seen, Philadelphia is about in the middle amongst the cities in the country.
Are you measuring all cities or just large U.S. cities?
Large cities where we can find information available on the web.
Thank you. And last question here. We've heard from your office that everybody in the city's database who's in 1A or 1B phase has been invited to make an appointment at this time. Obviously, that doesn't mean that they've all gotten one, but it seems if this is true that the city is sort of catching up on the 1B phase, I mean, how soon are you expecting to move to 1C, especially considering your 50% projection by the end of April?
We think we'll move into phase 1C sometime in April. I can't tell you whether it's going to be early April or mid-April, somewhere around that time.
Okay, thank you. That's all.
Thanks, Max. Next up, we have Laura Smythe from Philadelphia Business Journal. Laura, you can go ahead and unmute.
Hi, thank you. My questions are for Dr. Farley. I just wanted to first confirm that if Philadelphia's restrictions are eased on April 30th, that then those capacity limits will fall in line with the state levels. So 75% indoor dining, 25% for indoor events, and 50% for outdoor events.
I'm not going to guarantee that that's what we would go to. It really depend on what the case rates look like and how much they're declining and how well we're doing in vaccination. And I should also point out, and this is important for the business outlet yourself, we think it's important for restaurants to invest in improvements in ventilation over the long term anyway. This virus is going to be with us for months, if not years. And so we all have an interest in restaurants having better ventilation. So we will probably have a different limit for the capacity according to whether they meet our ventilation standards or not. My understanding is that restaurants are receiving federal funding. So this is a good opportunity for them to use that federal funding to invest in improving their ventilation. That'll help the restaurants, it'll help their customers, help the city as a whole. But exactly what the percentages will be, we'll have to determine as we get closer to that date.
Okay, understood. And just to follow up with that, if occupancies do increase for April 30th, do you anticipate that would apply to entertainment facilities as well, like casinos, theaters, museums?
It would probably be part of our broader relaxation restrictions, yes.
Okay, perfect. Thank you.
Thank you, Laura. Next up, I have Jack Tomsick at the Metro. Jack, you can unmute.
Okay, thank you. This is for Dr. Farley. I mean, is there any indication of why cases are going up? Is there any particular areas of spread that you're seeing?
It's pretty broad spread. The only thing that I've noted is that the areas that are being hit the hardest now are the areas where the virus first hit hard a year ago when it first arrived in this country. And I don't know if that means that those are the areas where variants are arriving now, or if this is the partial immunity that happened from that wave has waned. And so now we're more susceptible than other parts of the country. But other than that, there's no unusual pattern about the demographic or the geographic distribution of cases that gives us clues.
Okay, and then with the convention center site, has the federal government, are there any talks about extending that site at the convention center past its current date?
There's talks, and we put in requests. We have no confirmation that they will extend it. We would love to have them extend it.
And with the Johnson & Johnson vaccine, will the city be receiving any over the next few weeks?
We haven't given no guarantees of getting any Johnson & Johnson vaccine other than the vaccine that we would get specifically for the convention center. But as far as the city as a whole to distribute, we've been given no guarantees. I'm reading in the papers that they say that there might be a lot of Johnson & Johnson vaccine available sometime in April and May, and I'm hopeful that that's the case. We've been given no information directly from the federal government about that coming here yet.
Okay, thank you.
Thank you, Jack. Next, we have David Melanger from Philly Sports Network. David, you can go ahead and unmute.
My question is for Dr. Farley. I just want to make sure I'm understanding. So as of right now, the city of Philadelphia is not going to match what the state says regarding for like sports stadiums for capacity-wise?
That's correct.
And you're hoping by April 30th, you think that could be a possibility of increasing it or even go halfway?
I think it's a possibility by April 30th. Yes, we're going to look and see what direction the cases are going.
Okay, and my last question is for the mayor. Today was a big day for Philadelphia as FIFA came to town for the tour, the potentially for a World Cup coming to Philadelphia. Can you just give me an idea how that meeting went today?
I was not involved in the meeting.
All right, thank you very much.
Thanks.
Thanks, David. Next up, we have George Solis from 6ABC. George, you can go ahead and unmute.
Good afternoon, Dr. Farley. My question is for you. What is the plan right now to expand vaccine accessibility to the Latino and Hispanic community, and where do requests for proposals stand for groups interested in trying to open mass vaccine sites in some of these underserved neighborhoods?
Right. So we are expanding the neighborhood-based clinics that are run by the health department and by the fire department, as I talked about earlier. And we are in the discussions with the federal government about expanding with getting federal support for additional large volume sites. We are also encouraging other providers who have vaccine to offer vaccinations in underserved areas. So that would include pharmacies, that would include clinics, that include hospitals. And as far as the request for proposals, certainly the request for proposals gives a preference for organizations that can reach underserved populations, particularly African American, Latino, and we received applications. We're reviewing those applications. Don't have any to announce today, but that's a rolling process. So any new organizations that apply, they can still be reviewed.
Is there any talk or plans of expanding or opening up a new FEMA site somewhere down the road as things kind of continue with success of the convention center?
Yes, absolutely. So we are talking to FEMA and the federal government more generally about additional high volume sites. We don't have anything to announce today, but we would certainly welcome that.
Thank you.
Thank you. Next up, we have Argenis Figueroa from Univision. Argenis, you can go ahead and unmute yourself.
Okay, thank you so much. Good afternoon. Armando, voy a necesitar tu ayuda, por favor.
Bueno, Argenis, con gusto.
Muchas gracias, Armando. Mi pregunta es para el doctor Farley sobre cómo piensan abordar el proceso de vacunación para las personas que están en proceso de adicción a drogas, que en su mayoría están en Kensington y que pudieran pues no tener el mismo acceso a las vacunas como un residente. De hecho, hoy va a haber una protesta y esa es una de las peticiones de organizaciones y de la comunidad.
¿Te refieres a otros residentes del centro, Center City?
No, digo los residentes, digamos, de esas comunidades que son una de las más vulnerables, ¿no? Entonces,
correcto, en contraste con los residentes del centro, es la pregunta. Gracias.
Pudiera ser. Sí.
Como no, Argenis. Dr. Farley, the question is, how do you plan to approach the vaccination process for people who are in other neighborhoods, in Kensington specifically, who may be facing issues of drug addiction? And in fact, there is a protest scheduled today making such a request to get same access as residents from Center City for vaccination.
Well, when we had the open access at the convention center, that was available to people without appointment from any of the 22 zip codes that had the lowest vaccination rates. That included Kensington, so anybody from Kensington, including people who were living on the street in Kensington, could come into the convention center and be vaccinated. Now, we know many of those people won't do that, but we are expanding our offerings in areas around the city that are under-vaccinated, including Kensington, and we'll continue to do that. And in addition to that, we have a process specifically for matching up vaccine provider organizations with congregate settings so that homeless shelters, for example, we will have staff that will go in there, typically not working for the city, but working for other organizations that will be providing vaccinations in the shelters. And then, working with a variety of homeless service organizations, trying to then go beyond that to people who are homeless people living on the street.
Como sabes, Argenis, nosotros hemos tenido un acceso abierto en el cual no se requería tener citas para los 29 códigos postales de la ciudad, y nosotros nos damos cuenta que esto incluía a la población de Kensington y a los sin hogar, pero nos dimos cuenta que el acceso al centro de convenciones en el centro no atraía a mucha gente. Sabimos eso y hemos tratado de cambiar la forma de acercarnos a esta gente, y tenemos un programa en el cual a los residentes de Kensington, y vamos a continuar ofreciéndoles acceso continuo en un proceso que incluye a las organizaciones comunitarias y especialmente aquellos que atienden los entornos congregados, incluyendo los asilos y los refugios. Y estos no son organizaciones que trabajan de la ciudad, sino con la ciudad. En estos refugios se está trabajando con aquellos que tienen problemas de adicción, con aquellos que no tienen vivienda, y se está proporcionando servicios a los sin hogar con estas organizaciones comunitarias que les proporcionan el acceso. Y vamos a hacer que las vacunas sean accesibles a través de este medio. Gracias.
Okay. Muchas gracias, Armando. Es todo. Gracias.
Is that it for you, Argenis?
Yeah.
Great, thank you so much. Next up, I have Martin Pratt with Philly Your Black News. Martin, you can go ahead and unmute.
Thank you. This question is for Dr. Farley, or I guess maybe Tumar. Is there any word on the reopening of the senior citizen centers throughout Philadelphia that has been places for senior citizens to get lunch and to get information?
Afternoon, Martin. We're going to check on that, but I think some of our centers may have started reopening and doing some limited hours, but we'll check and get back to you on that.
Thank you. That was it.
Thank you so much, Martin. Next up, I have Denise Clay from the Philadelphia Sunday Sun. Denise, you can go ahead and unmute.
Good afternoon. I kind of wanted to get some information regarding the vaccine and homebound people. Is there an update to what's being planned to help them out? Or do they still have to go to their doctor for it or make some sort of arrangement? Is the city doing anything in terms of getting the vaccine to homebound people?
Yeah, so a few things we're doing on that. First of all, if they're truly homebound, then their major risk is being exposed to the virus from somebody who goes into the home to take care of them. And so that's why early on we set a priority on having home health aides being vaccinated. So that's some level of protection there. But yes, we do ultimately want to vaccinate the homebound people themselves. If those people are homebound and they're living in a larger community with a lot of people who are elderly or can't leave their homes, they're part of like a senior housing facility, there may be organizations that are going to go to that senior housing facility. We are working now to pair up vaccinator provider organizations with those sorts of settings like senior housing. Then there will be some isolated homebound people who are not part of that. And we are working with trying to develop mechanisms to do that. That's going to be a longer process. There are organizations that do go into homes that we are going to see if we can pair up with. And we'll see if we can generate lists of those people and get in there and vaccinate them. But because we have to do it one at a time, that's going to, spread out over probably months.
Okay, thank you.
Thank you, Denise. And finally, I have a second round follow-up question from Jack Tomsick at the Metro. Jack, if you want to go ahead and unmute.
Yes, thank you. This is for Mayor Kenny. It's about SEPTA. Do you think SEPTA made the right decision to temporarily close the Somerset station? And what is the city doing to try to support SEPTA with the situation around that station?
I think from what I understand, they had to close it in order to do the extensive repairs to the elevator system that was caused by folks doing things in there we hope they wouldn't do, but do anyway. SEPTA, I think, has made the right decision as long as it doesn't go on forever. And we have been meeting police, managing director's office, and other agencies within the city, home services, with SEPTA to develop a plan to make it safer and to get that station open.
Right. Thank you.
Okay. Thank you, Jack. Seeing no other hands raised, that is going to be it for today's briefing. And if anyone still has follow-ups, they can send those to press@phila.gov. Thank you, everyone, and we will see you next Tuesday.